Same way with breastfeeding, though it's very, very natural. It's the most common thing, or it's the most beautiful and the most wonderful thing that a mother does after giving birth. But that being said, it's an art. It needs to be learned, it needs to be honed, it needs to be understood. And if you have a helping hand in that, then your journey becomes a little easier. Because there are so many myths around it, like pain is okay, pain is normal, it should pain a little, your milk supply is not enough. There are so many advices around it. That is what confuses and you no one to help. Yes, there's no one to help, and most of the time the people that they think that they're helping, but a lot of times they're not. So let's talk about it. Good morning, namaste, hello. Myself, Dr. Aishwarya Mehta from Motherhood Pune. Today we are here to discuss one of the vulnerable and most unspoken topic, which is breastfeeding and lactation. Conversation is very deep and powerful in terms for new mom or a new parent. So this conversation is all about you. From understanding the low milk supply, common issues that parents have like the tongue tie, lip ties, what to do, how to do, whom to discuss. So we are here to help you with all of this. We are joined by one of our specialists, Parul Mudit Mishra. She's a lactation consultant and an infant care specialist, a mom and a professional with she's helping a lot of families with her science backed knowledge of overcoming all this difficult journey, making it smooth, confident, giving the new moms a new perspective of life, because it's not a small journey of a day or two. It sometimes keep going for 3 years or maybe more than that. So she's one of our panelists who can help you with all of your questions. Sit tight, grab a cup of tea so that we can discuss all our questions with our one of the specialists on the panel. We are pleased to welcome Parul Mudit Mishra onto this podcast, wherein new moms can discuss all their questions. And we all know that you will be helping a lot of mothers and new moms, new parents to make the journey smooth. So, just want to understand from your point as well. So, can I have a few words from you also? First of all, thank you for having me here on this podcast. It's a privilege to be talking about breastfeeding and lactation. That is something we hardly speak about. Trust me, when I started this journey of being a mother, so it started with me being a mother and struggling with my own breastfeeding journey. And eventually it moved on to being a professional who is assisting other patients and people with their lactation journey. What I've noticed is 6 years back, 5 years back, 10 years back, there was nobody who would know who is a lactation professional. Even today, when patients walk in, they're like, patient professional, is that a thing? But the point is that earlier we used to live in communities. We didn't need as much help. But just like, so giving birth is natural, right? Giving birth is natural. All the mammals are giving birth. But they do not have gynecologists, do they? They're able to go ahead and do it themselves. But we have to make sure that we are taking care of our health. So though it comes naturally to us as well, but we have a supportive care team, people who are trained enough, knowledgeable enough to assist us with birthing process. Same way with breastfeeding, though it's very, very natural. It's the most common thing, or it's the most beautiful and the most wonderful thing that a mother does after giving birth. But that being said, it's an art. It needs to be learned, it needs to be honed, it needs to be understood. And if you have a helping hand in that, then your journey becomes a little easier. Because there are so many myths around it, like pain is okay, pain is normal, it should pain a little, your milk supply is not enough. There are so many advices around it. That is what confuses and you no one to help. Yes, there's no one to help, and most of the time the people that they think that they're helping, but a lot of times they're not. So let's talk about it. It is important to put it up there. Yes, sure. According to you, what would be the right time to reach a lactation consultant before the baby is born? So do you get any kind of a help when you was about to expect, or is this just something that came out of naturally to you? I think the best time to talk about it is while you're pregnant. Okay. Best time to seek a lactation professional's help is while you're pregnant. Why is it important? Why is it necessary at that point in time? Is because there is so much to learn and understand. There is so much to learn about colostrum, about lactation stages, about the fact that you're already making milk while you're 16 weeks pregnant. So you're already making milk. So how can the supply be low once the baby is delivered? Plus the understanding that even with C-section or with normal delivery, whatever the mode of delivery is, latching is very, very important and it has to be done in the first hour where the belly size of the baby, then your breast anatomy, understanding how my own body works, whether, and then having those questions and getting them answered. A lot of times the antenatal sessions that I'm taking, the questions are mostly around, ma'am, my family says I'm not supposed to eat this. Do you think that this is okay? My family says that right now I need to start massaging my breast. Do you think it's okay? So the question is that there is a lot of input that is coming. So that's coming from social media, it's coming from your family, it's coming from your friends also.
Yes.
I think friends are your biggest lactation professionals.
And
Sometimes it becomes so difficult to let them know that okay, it is working for your friend, but it might not work for you because your body anatomy is different than hers. So that being said, we need to go ahead and so this is a two-part equation: the baby and the mother. Okay, and both of them have to come together for the feeding to work. Now, at least if I know what the equation, one part of the equation is, when the next part of the equation comes, it becomes easy for a lactation professional to blend them. That's one. The other thing is that whatever hospital you are choosing, because people choose hospitals, people choose gynecologists that, okay, this is where we want to go. I would recommend please check if they have a lactation professionals. You know, if they have somebody who would be able to help you, and then what is their policy on supplementation? So you need to ask these questions before deciding where you want to deliver your child, whether the golden hour, feeding is happening even or not. Because you might see something on the internet, but in reality, that's not happening.
That's what happens. So most of the hospitals, they showcase that they have a consultant, they have the adequate help, but they don't have. Yes.
Thankfully, with motherhood hospitals, we have lactation professionals. We have a team of, there is a team of even lactation nurses who are able to assist if in case we are not present. So the idea is to build a team and have a structure in place so that the mothers are supported.
Yes.
So that is the same thing that we are expecting from the app as well. So there is this Motherhood One app that we are launching. So we would want you guys to ask questions there as well, because asking questions beforehand is the key to having a beautiful journey.
And I think this Motherhood One app is one of the most reachable way to discuss on all your things with the consultant or your doctor or your gynecologist or a lactation professional. They can directly reach out. So this is one of the good initiatives that I think motherhood hospitals have really started.
Right. And you also ask another question that, why am I here? Like, what's my journey? That has supported my journey.
Yes.
So the point is that I had nil support whatsoever. And everybody around me was telling me, just latch the baby, just put this thing into its mouth and the baby will start latching. Unfortunately, both of my kids had tongue ties.
Oh.
And nobody understand that the baby is not able to latch because it has a tongue is practically tied to the base of the mouth, and the baby is unable to just go ahead and suck it. That's the reason the baby is not taking milk. And then somebody suggested start pumping, and then so my husband was being the most amazing husband he is. He went to the store and he's like, whatever the best pump you have, you give me that. And he got me a very good pump. But the problem was it was not my plant size. So a lot of times in ANC, people are coming with breast pumps as a gift for baby showers. So I would recommend don't gift a breast pump for a baby shower, because the point is you don't know what is her nipple size.
Yes.
So if it won't fit her, it might end up hurting her and her supply in the longer run. So I had loose nipples because obviously the pump was not my size. And then I started looking for solutions. And that's when I got to know that there is something called lactation professional. My sister who delivered in US, she told me that, here though we have this support. I'm like, why don't we have it in India? And that's when I started reaching out. And this was pre-COVID. So there was hardly anybody doing any online consults. Thankfully, this person in US, she took me an online consult. She told me your baby has a tongue tie. Now I am hopping pediatrician to tell me that, my kid has a tongue tie. Can you help me? But I was back in Lucknow. So back then, things were not that advanced. People were not at pro understanding what is happening, what is not.
That very much clear about all those things.
Right. So that's why I decided to become a lactation professional. I was like, if there is a way, because I'm a non-medical.
Yes.
So I was like, if there is a way for a non-medical to go ahead and do this. So I realized why not. And then I studied hard. I got to read books. So I studied hard. It was a curriculum for MBBS that you guys do. Similar curriculum that I had to give an exam on. Once all of anatomy, physiology, all those subjects, psychology even. Once that was done, I was eligible to take a lactation course. And once that was done, then 1,000 hours of practice. And once that was done, then I was eligible to give an exam. And that's when the practice started. So it was a hard, long journey.
It was a hard, long journey.
But I'm glad I did it.
So, for example, somebody has not reached out to you earlier when they got to know, but some 2 to 3 weeks have already passed. So, what would be your suggestion during that course? They can come and reach out, and what kind of a help as a lactation consultant you can provide? Because now that they have not reached before, but they have already passed 2 3 months. So, what would be the another step that they could take help from you?
Great question. And trust me, it happens more often than not. Because once you've had a baby, there is a lot of overwhelm. Okay, so you have to take care of your body, you have to take care of your surroundings. It's restriction, you can't get out of the house for the first 40 days. In a lot of communities, it's saying that. So, roughly to second month or third month is when moms start settling down. Okay. The thing is, a lot of times they have had formula to be supplemented to the child. So, eventually, we start with, so ideally, you should start with the advantage of your southern part of India, and if teeth up is something that can be used. Completely understand and relate to that. The only problem here is the kind of bottle that is being used, right? Because the kind of bottle that is being used makes it very, very difficult for the baby to come back to breast from the bottle for the very simple reason that the bottle feeding, the maneuver is very different. So think of it this way: that if I'm supposed to drink on the breast, so if this is my breast and this is my tongue, the tongue is supposed to go below the breast like this, okay? And the upper lip comes here. So upper lip comes here, the tongue comes here. They both create a vacuum. In this vacuum, when the tongue moves, the milk goes from this area to this area due to negative pressure. Negative pressure. That's how the transfer happens. Now, on a bottle, the baby just does this. So because the tongue can't do much on a silicone chain, so the pressure is from the jaw. Now, the same kid, if it comes to the mother, even if the kid is latching, it will bite the yes. And it will be very, very painful for the mother. And plus, if you're taking something from a straw, you do this. If you start doing this, you're not going to get anything. So you're not getting, the baby doesn't get anything. The mother thinks she has to supply. That's why baby is not latching. The mother is using the wrong pump size, so she definitely has a loose supply now, by now. And the baby is used to a bottle feed and bottle feeding. The maneuver is different. So what we need to do is, what I usually do is I change the soil. Okay. Then I work first on working on changing the water pattern of the baby so that it comes from biting to sucking to suck, right? And whenever you are choosing a bottle, so ideally we shouldn't be using bottles because bottles can alter the environment. The baby, which is not good in the long run for the child. But if at all you have to, I mean, you don't have a choice, there is a certain reason that you need to, then always go for a triangle test. A triangle test is very important whenever you are looking at the teeth of the bottle. So any bottle, whatever. Ideally, we do not recommend what we did. We shouldn't be talking about it. The problem is that when we don't talk about it, you just go ahead and buy something by using it. So no brands being talked about here. But I want you to look at the triangle. Just go ahead and make a triangle out of your mind and see whether the teeth is in the shape of a triangle or not. But if you see holes or gaps here, which means the teeth is very, very small here and there is a slope here like this, it's not a good one. So it has to pass the triangle test for you to feed your child with that. And if you use that kind of a bonding, it's easier for the baby to switch from bonding to breast. So there are a lot of things we do over there. But what I want to convey here is that it's not you. It's not your fault. It's not that you don't have enough milk supply because first 45 days or so your supply is mostly hormonally driven. You would never have a milk supply. But the problem is you don't know whether your baby is getting food. You don't know how do you know whether your baby is getting food. And, you are unsure, and then you have this box of stuff with you. You want to use that because you think that the baby is not getting enough. So the confusion is the major part of it. And when you get the clarity and you come to us, the lactation professionals at second or third month mark, we have our toolkits. We are able to fix it for you.
Even when we use books, we read through from online stuff and other things. I don't think that this all will help them unless you don't visit a lactation consultant. So my advice to all of the new moms is to please do visit, even at the right time visit. That will definitely help. And I think our Motherhood One app being all of doctors on that panel will definitely make their whole 9 month journey and even after that very smooth. Very smooth. Yes.
So I think the biggest challenge with these mothers is that they are not able to get out of the house and reach the professional. That's where Motherhood One app can bridge that gap. Online consultation services and questions and answers. Probably you get better insight into your problem and you can take one more step towards solving
Yes,
it.
because the way you mentioned the triangle test of the bottle, nobody knows that. We normally go up to the pharmacy, we normally go up to the shops and buy the best branded milk bottle for the baby. But we don't know what is the right for them. So to know that, you definitely have to approach the right person. That's okay. We all have heard about the golden hour thing. So, but we don't know much about that. So what is golden hour thing and why it is important in the journey of breastfeeding?
So we all are aware that whenever we are trying to do something new, the start has to be right. The beginning, the first step has to be ongoing. So with breastfeeding, let's understand a little very basics about anatomy and stuff. Probably very maybe put in the slides. So your 16 weeks, your lactogenesis one starts where you start bleeding, right? So milk is there. Prolactin is doing its job, it's making the milk. Now, the moment you deliver, doesn't matter mode of delivery. In whatever the mode of delivery is, when you deliver, that is when your placenta is out. Yeah, your progesterone will start coming down your milk. Progesterone is the hormone which keeps the milk inside. So that even when you're producing, you just grow a cup size, you have the regular darkening, but you wouldn't start eating that. That's very good. But usually progesterone keeps the milk inside. So the moment the placenta is out, if the baby's what do you say, saliva attaches the nipple within the first hour of birth. Okay. One, it helps regulate the temperature, body temperature of the baby, regulate the coordination of sexual breathe for the baby, helps the milk ejection reflex, which is when the baby suckles, the oxytocin starts flowing to the mother's body and the milk starts coming out. So the sooner it comes out, the better it is for the breastfeeding journey because that bonding itself, what it is, the mother looking at the child and the child suckling at the mother's breast for the very first time. Trust me, I think it's divine. I do this for an RP for each every patient here at Motherhood Hospital Therapy. So I know how it feels. And I sort of sometimes feel that, this is the work of God. It's really,
And it's very emotional for both of them.
exactly. And that tear down the mother's eye when that baby is hatching. I mean, why not give it to God? Why not let her have that opportunity? Because any which ways, if that first 3 months are gonna make her the world crash down, it's difficult for him. I think it has been difficult for most of us. But that latching, it does so much for the baby's heartbeat, it does so much for the baby's body temperature, it does so much for the baby's appetite. It does a lot for the mother's breast and lateral tissue because the machinery knows, okay, now the baby is around, let's let it out. So, and if you are able to latch the baby for the first 2, 3 times, the milk, the job of the milk, the secretion and everything starts automatically. I mean, you don't have to put in extra effort to make sure that the milk comes in and all of that. Because in the first 3 days, we have colostrum. Colostrum is this thick milk. A lot of times you might have heard that, mata pe gada, yes, and I need the government at Another thing is it might not be Tila and Gaga. Right? It could be
So
very
lifestyle,
lifestyle.
maybe it has affected.
No, it is body to body. The body type differs, the color differs. So first habit.
Okay.
So that is because of the rusty pipe syndrome, which is absolutely normal and safe to the baby. Because there was this patient delivered somewhere else, came to me, and I am getting let me have a look. And then I saw that she had rusty pipe syndrome, and everybody told her that don't eat. And that led to a lot of engorgement and ascites and breast infection and all of that. So if you have rusty pipe syndrome, again, seek help from your lactation professional. Get it checked whether it is rusty pipe or not, whether it is something else. Because it's very important to work under guidance. Because if you're working under guidance, you're safe, you're secure, everything seems to be going okay. So that colostrum is the first vaccine of the child, is what we say, because that gives that has the more immunity. Yes, it has so many immunological benefits and everything. So baby suckling that within the first hour of birth is like a cherry on the top of the cake for us lactation professionals, because then The milk coming in, the milk flowing, it all becomes very, very easy.
So, but during that time, it's not difficult for baby to like to have that kind of a grip onto the mother. Is it that difficult or is that easy?
It's the most natural thing for the child. You know why? Because it's been practicing this from the 34th or 35th week, the baby starts doing so. Swallow starts very early on, so your mouth is open and you just swallow. So mouth is open and fluid is around you, you just swallow. But suck and swallow, which is you put an effort to suck it up.
Yes.
And then you put an effort to swallow. That is something that you start from 34th, 35th week. Some kids even early. And then you practice it. And once you are out, now you need to coordinate three things: suck, swallow, and breathe. So the moment we put the baby on the breast, because the breast smells like amniotic fluid, because the colostrum smells like amniotic fluid, because your mother create amniotic fluid, the smell, the baby knows, okay, this is the thing. And the baby starts feeling. And so it's a kind of a familiar thing to them. Exactly. The only challenge here would be if the baby has any kind of oral restriction.
Okay, yes. Just one more question I'm very curious to ask about. So, is this low milk supply? Is this for real actually? And is that actually being affecting the mother's mental health and peace? So, is this a true or not?
Tricky question, but happy to answer. Let's understand what do we mean by low milk supply. So when we say low milk supply, what we understand is that I am not producing enough milk. My baby is not getting full, right? So that is the understanding. Problem is, how are you reaching this understanding? That is the first issue, right? That how do you think that there is low milk supply? So if in 24 hours, your baby is roughly 5 to 7 days old, and in 24 hours, baby is peeing 7 to 8 times on your breast. Like baby is latching and is peeing 7 to 8 times. Means baby is getting enough. Okay. And in next week, that is the first week after birth, if the baby is gaining somewhere around 100 to 140 grams, let's keep it on the lower side, 100 to 140 grams per week, then the baby is getting enough milk. But the problem is, we are not sure about these two markers. We don't look at these markers. What we look at is baby's crying, must be hungry. Baby's crying, must be hungry. Baby's tired. So crying can happen for so many reasons. But if the baby is seeing enough, then it is good. There could be hormonal thymic imbalance, wherein the baby is taking what the milk assignment. There could be latching issue. There could be shallow latch. There could be insane. There could be nipple pain. There could be so many variable things which needs to be fixed to make it better for the mother. Right? There could be cluster feeding. Cluster feeding is something which is very common. So this low milk supply we hear mostly at 1 month mark. Why do we hear that at 1 month mark? It's because at 1 month mark, the baby goes through a major growth spurt. And during that time, the baby wants to latch it every 1 hour.
Every 1 hour.
And that is for 5 to 7 days. Now, during those 5 to 7 days, the mother is like, oh shit, no, it is what it. Let me just go ahead and get it supplement with formula because I don't think my baby is getting. But what we don't realize is the umbilical cord is gone. There is no way that the mother and baby's body is talking. So this salivation and excessive latching is what lets the mother's body know that now the baby is growing. It needs to change the composition of the milk.
Okay.
So think of it this way, that breast milk doesn't really change in ounces. The amount that the baby makes, it hardly changes. Amount remains the same, but the latching and excessive doing this, sucking and transferring milk, it changes the composition so that the baby is full in the same amount of milk, but takes the same amount of milk full longer.
Full longer, yes.
That is something that happens. Because a lot of times moms think there is low milk supply at 3rd month mark also. Now during 3rd month mark, baby's vision is clearing, sound is getting better, hearing is getting better. So now I'm easily distracted. I'm doing, and then I'm distracted. I hear. Or I would feed only for 5-7 minutes and then play for 5 hours. Now this mother who's been feeding every 2 hours, 20 minutes at a stretch, at 3rd month mark, suddenly a baby is not latching for more than 5 minutes. She's like, okay, I'm going to pay. Then around the same time, there is something called lactogenesis 3 that is happening in the body, which is wherein the body adjusts according to the needs and demands of the baby. So now that excessive hardness, tightness, leakage, all of that will not be there. Because now the body would completely adjust. That starts from the 9th day of birth. And then slowly by 45th day, most of the women would see that adjustment that, okay, I don't feel any tightness. Now, because you are thinking that supply is related to the tightness and the softness and the leg down and the leakage, because everybody else around you gets told,
Yes.
you start thinking you have no milk supply. But what is actually happening is that once you get married, I give this example mostly. Once you get married, you want to cook all the good pakan in the house to impress your family, right? अभी कोफ्ता भी बन रहा होता है, अभी मस्त पनीर टिक्का भी बन रहा होता है. But एक महीने 2 महीने बाद सब लौकी तोरी पे आ जाते हैं ना. Why? Because we can't have that all the time. Same way, body produces a little extra. A little extra. When the baby is born, body doesn't know whether it's one child, two child. Body doesn't know what's the weight. Body doesn't know what's the appetite. So it's always a little extra. A little extra. But then it adjusts. And when it adjusts, you start thinking that there's no way it's okay.
But I think this definitely gives a impact on the women's mental health.
Exactly.
Plus the kind of advices you are hearing from all around that आप अजवाइन खा लीजिए, आप ये खा लीजिए, इससे थोड़ा ऐसा हो जाएगा, उससे थोड़ा वैसा हो जाएगा, आप वॉकिंग ज्यादा कीजिए और समथिंग लाइक दिस. So definitely I think वो mental health पे it is impacting too much.
I would agree 110% because I think most cases of having postpartum depression, naked blues, and all of that we see in the first 6 months.
First
And why do we see that? Is because the advice that you're getting is contradictory from your doctor's advice.
True.
And a lot of times you hear this also, हमने के बच्चे पाले और ये डॉक्टर्स को क्या पता है?
बस ग्रैनी जो होती है, दादी नानी होती है,
Right.
they are all around giving you free advice.
And see, it's not always bad. So, for example, we can always pick some things which are good, like ajwain water is very good for your digestion. You should have it. Science also picks it like you can have ajwain water and all of that. But the point is, having galactogons were things that would increase milk supply. You would say like oats, methi, milk thistle, all of these things which are like gold killer, which is traditionally in our
Yes.
and having a restrictive diet, which is eat only watery food, eat only kia. If you eat mircha, the baby will get gas. If you eat mangoes, baby will get reactions. If you eat dahi, baby will get cold. No, Baba, no, it cannot happen. Let's understand why it cannot happen. You eat food, it gets digested. Basic science. You eat, it goes into the stomach, it goes into the intestines, it absorbs. Whatever absorption is happening in your blood. Now that blood flows from there to your breast. That fuels the milk growth. So now tell me, how is it that
It's
your
all
blood
nutrients
would
that
have
Yes.
this. To make milk, you don't need milk.
Yes.
Or else I would be out of job and you would be standing at a dairy saying, "Bhaiya, 2 liter dena, mujhe bachche ko दूध पिलाना." It doesn't work like that. So your diet has to be healthy and balanced.
Okay.
You should have enough protein. So a breastfeeding mother should have 25 grams extra protein every day. So which means your current weight plus 25 grams is how much protein you should have every day. And that much protein is necessary for your weight loss and baby's weight. Because a lot of times we see all these galactogogues, you are gaining weight and the baby is not gaining that much weight. Because you're being given Shira and Halim and Alim and a lot of things. Now, they're not all bad. But moderation is the
Moderation.
because you might end up having a lot of fore milk, then hind milk, then baby would have to suffer.
Yes.
Then the myths. मैम इस साइड खाना आता है इस साइड पानी आता है ये खाना खिलाती है पानी नहीं पिलाती है so myths like that we should be wary of them we should understand it and I think grandmothers if any grandmother is listening to this please understand your age old advice we respect that with all our heart we respect the intention the love that you have for the baby and the mother we adore that but with times things are changing and we need to kind of adapt and evolve with these changes so that it actually helps the mother because this contradictory advice puts already the mother who's already going through baby blues extra pressure and mental stress. So 1 month home ignore sometimes if it's not serving you simply choose to ignore it. Don't let it affect you because if I hand you a piece of dirty garbage you're not going to take it from me. Even if I insist, please take it. Will you take it from me? You're not going to take it from me. So if the words are doing the same thing to you, why to let them affect?
Because what happens is all these studies are science backed. And plus they are backing all these with their experience. So they're speaking only with the base of experience and you are speaking with the science backed knowledge, with all of your hardcore education and other things. We definitely rely on the doctor that is give us proper support in throughout the journey. I completely understood.
Thank you.
So we all know that there are some babies who are born with tongue ties, lip ties, and parents are mostly aware of that, but they are not much aware that how to deal it and how to watch out the signs. Can you help them with your understanding?
So let's first understand, is it something new? Because it has come across as something new. I mean, it's a machine, but I will tell it that and that. The point is, it's coming from ages old. I mean, if you look at the history, there were instruments to release the tie in our history, right? And it has been affecting the jaw, the structure, the oral motor pattern, and ideally, it's the problem of developed world, I would say. In underdeveloped world, in traditional countries like Africa, where they're eating coarse stuff, not very refined, but coarse stuff. They're chewing the meat and their bone structure, jaw structure is different than, right? With evolution, things are changing for us. And the recent research that I just attended a webinar about this, we got to know that we are seeing more tongue ties and lip ties and IVF babies. Now, we are not sure how that is correlating, but the point is we are seeing the incidences now. And when we are seeing the incidences, I want to point this out that good support, good latch, the basics have to be in place. I have seen a baby with an anterior tongue tie breastfeeding beautifully, talking beautifully, not having any issues whatsoever, right? But the support has to be embraced. You have to have people who are going to help you and support you. There are a lot of things we can do for these kids, but the first point would be to identify. So if you are having a consistent nipple pain while eating, if the baby is having a lot of hiccups, probably after every feed, if the baby is taking very, very long feed and not getting full, okay, right? If the baby is having difficulty staying away from the breast, you put the baby down and the baby tries like anything. There's a lot of calling and reflux. You're taking the baby around and you're not taking the baby down. You have to supplement because even though the milk is dripping from your, but supplementation is needed, right? And you feel that biting sensation at the breast. So let's go ahead and understand how breastfeeding should feel like. So if you pinch this, if you take 2 fingers and pinch this and massage it like this, if this is how you feel at the breast, that's right. But if you start feeling like this, just do this for yourself. Take your fingers and press it like this. If you feel this sensation on your nipple, there is something either wrong with your latch or your baby could have an oral restriction. Now, not all oral restrictions are the same. We have different grades to it. We have different types to it. And depending on the grade and type, your professional, your lactation support professional, or your pediatric therapist, whoever you are reaching out, would assist you with going forward how to exit. Not all babies would need a LASIK treatment, but some babies would not be able to thrive without that LASIK treatment because your tongue. What do you use your tongue for? You use your tongue for breathing. That's the first thing. So all of us, let's just close our mouth. Okay, close our mouth and take a nice deep breath. So once you do that, you might have noticed your tongue rests in the upper lip side. And that is what the stabilizing force is. But now I want you to take another deep breath, but keeping the tongue down. Let's do that. Gets it a bit difficult to breathe, right?
It's difficult.
So which means right. You might see open mouth breathing, you might see milk coming out of your mouth while latching. Even with the bottle, the milk might drip in from here. You might see clicking sound at the breast because the tongue is not able to cup the breast entirely. So all of these things you would see in your child, and thus because it affects breathing, and later on it might affect the speech as well. It might affect the moving in a manner that the baby might have ADHD-like symptoms because it might affect the brain not giving enough oxygen because of open mouth. So it's a whole host of symptoms with issues. But the earlier we catch it, the earlier we fix it.
Mostly what happens is parents are not able to detect it early until and unless the patient is unable to speak properly or unable to speak few words properly. They cannot get to know that this is a tongue tie or a lip tie or like this. So I think you have given a great viewer with a great example to understand the new points, the science, and how to understand that this is actually the thing
To be addressed.
yeah,
Because the whole idea is that you want to wait because maybe he's not having, you're not talking, by the way, both my kids needed the surgery. Oh, so one of them we worked with a speech therapist. So thankfully that was handled well. But one of them had to have a surgery because the list was there and was 10 on 10, 10 on the full day. These two things. So I had to get the surgery done at 3 which was very painful, very exhausting for us as a family. So the idea is if it can be fixed, it's a very, very small baby. Without using anesthesia, it becomes easier for the baby to go about later ones. Yes. And these kids do end up having picky leg. So if your child had these symptoms when the child was a baby and you had to supplement and you thought that you can't have leg. So this is also one of the reasons the mother could think she has a low L. Because baby's transfer rate is low. That's why I said there are two parts to the equation. That okay, this is what you have with you. And only 1 to 5% is the whole. Tissue is not and that's when the milk production is well supplied. That is when we say no milk supply. But in my practice in last 3 to 4 years, I've seen only 2 patients like that. Okay. So and that too, we were on combination feeding. It's not that she couldn't feed at all. Okay. So that was also there. So understanding this is very important. Supporting these babies is very important. And supporting these parents is very, very.
All the new moms are mostly the working moms. So as in when their leaves get over, they have to be on their job. They have to do their all the daily routines work. So in that case, they mostly we have observed that mostly they used to pump and store the milk. But according to you, what would be the right steps and what would be the precaution that she should take to freeze the breastfeed milk and some breast pumping strategies if you can tell them so that it will help that pass this journey.
Excellent question. There is no other way to actually, what do you say, extend this journey. In our country also, the breastfeeding rates in the first 6 months are still good, but after 6 months, they're falling down. So says that you should exclusively breastfeed for 6 months and then complementary breastfeeding should continue with the complementary for 2 years. The reason for that is that at least the first year breast milk still stays the primary source of nutrition. We are just starting solids and complementary. The baby's not going to eat 3 course meal now at 6 months mark. So the breast milk still stays the primary nutrition of the child. Now to ensure that the first part is the pumping part. Yes. Now that you completed all practical. So I would recommend first getting yourself flat size check. It's very important that you get your nipple size checked because during this whole journey of breastfeeding, your nipple size would have changed from where you started because the BC does its work on the nipple and it changes. So get it reassessed that whether it is the right size for you. Then find yourself a primary pump. There are 3 types of pump. The one would be a primary pump. The second would be a secondary pump, and third would be a hand pump or a regular pump. Okay. Now, primary pumps are pumps which are meant for exclusive breastfeeding, exclusive pumping. So they have a higher motor. They are almost closer to hospital grade pump. They are single user pumps. Then there are wearable pumps. It's on the breast and all of that. Those are your secondary pumps. But if you want to, and if you intend to exclusively pump while you're away at work, if you have work from home, secondary pump might work for you. But if you do not have work from home, you have to go to the office and you have to store and keep the big bag in a primary pump would be better for you. Because the suction rates matter. The cycles matter. So cycle would be how many times it kind of suckles, and suction rate is the vacuum at which it suckles, which would be different in both the pumps. So primary pumps are the closest to mother's baby suction. So ideally, hospital grade pump is the closest. Then comes the primary pump. Then comes the secondary pump. Then comes your occasional side pump and side vessel. So again, choose your pump according to your need. How much do you need? Okay, that is 1. Flange size, that is 2. Third, having a structure in place. What time is it that you should pump? So ideally, the best time is between 5 to 6 a.m. in the morning. That is your productiveness, I guess. That is where we get the maximum out of it. If you still think that, okay, this is not working, probably you can try power pumping. Or you just Google this term, you'll get to know how to do power pumping. So power pumping is something that you can do in the early hours that would help you have enough output for yourself. That is something that you can do. Then comes to storing and freezing. So at room temperature, your milk stays good for good 4 hours. In your fridge, it stays good for 24 hours to 48 hours. ideally for 4 days, but I would recommend to keep it not more than 24 to 48 hours. And 24 hours if you have a premature baby. Because a lot of moms who are NICU clinic moms, they could also pump it toward the milk. So if you have a preemie, then try to give that milk within 24 hours to the NICU. Okay, don't keep it more than 24 hours in the fridge. Best container to store would be a glass container because there the loss of fat and lipids is least. Okay, but because glass has a chance of breaking directly to the milk, then the next best option would be steel containers with an airtight lid to store the milk in the fridge. Okay. Then comes longer term storage, that is when you're going back to work. If you want to have a longer term storage, then you need to store it in the freezer, but you have to use a breast milk storage bag. You can get it from all these places on like forums and stuff if you go ahead and get it. But it's very important that you make sure that it's a one-time use version. Right? You cannot just go ahead and say there's no so breast milk storage bags, you need to go ahead and use them. When you are using a breast milk storage bag, make sure that when you are pouring the milk in the bag, just lay the bag flat and remove all the air of it. And don't fill it more than 80% because the milk expands when it is frozen. So don't fill it more than 80% because it will expand, and make sure that air is completely removed and lay them down vertically in your freezer. Or else you will end up using more space if you just pour them, like if you make them sit straight, right? So lay them down. They can stay there good enough if you are using that fridge for other things as well, that freezer for other things as well. Then I would say 4 months or so, 3 to 4 months. But if you're exclusively using it for your breast milk storage, then up to 6 months is good enough. And in your big freezers, I mean, I have stored it in a freezer, so I've donated a lot. I've had hypolactation. And trust me, that's also a very big problem. People are like, I'm low blood supply, low blood supply. Bigger problem is having more blood because the baby would start coughing at the breast and not being able to drink nicely and all of that. And plus, you could have this tinkle there in your head. Okay, now it's time to pump. If you don't pump, you're gone. Right? So hyperlactation is also a bigger problem. So that freezer, the big freezers we use for ICU, they can stay good for 12 months. So what I would recommend you is first figure out how much you need, when you need it, what is your working hour going to be, and then accordingly use these tips. Always follow CDC's guidelines on breast milk storage. You can Google this CDC guideline on breast milk storage. It can also give you more further variants as to when I use the REA to how many hours later I need to reuse it and finish it, all those things.
I think with all of your answer to all these questions nicely would definitely help all our new moms, new parents, or their family supporting them. They'll definitely going to get a lot of knowledge and understanding because it has not covered only that when you start and how to start. It has mostly covered everything. That if you're going to a job or going to your office, how it'll be easy to be a mom at that point of the time and be carefree that your baby is having your milk at the right time. So
I absolutely agree with that. And I think our app is a catalyst in this because they can ask any question that it's needed. It's for every. And I would love to support more and more others with more and more information. Because trust me, I don't do it because it's my job. I do it because I believe in it. Because I know what kind of journey I've had, and I know how much a good supporting hand matters in this journey. True.
So, Motherhood Kharadi community is pleased that you are here on the podcast and help a lot of consumers and new moms. And thank you so much, Dr. Smith.
Thank you.
Thank you, Sulati. Lovely talking to you. Same to you.